If you've healed an ulcer, let's make sure you never get another one. This might be the most important module in our entire series because here's a sobering statistic that most people don't know. Up to 40% of people who heal a diabetic foot ulcer will develop another one within just 1 year. But that doesn't have to be your story. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas, with over 25 years of experience treating diabetic patients. In today's module, we're going to focus on what might be the most crucial topic of all: how to prevent ulcers from coming back once they've healed. Before we get started, I want to remind you about my comprehensive book on diabetic foot ulcers. You can get it completely free at www.footulcerbook.com. This book contains detailed prevention strategies that go beyond what we can cover in these videos. Please take a moment to like this video, hit the subscribe button, and share on social media. The prevention strategies we're covering today can help someone avoid the pain, complications, and cost of dealing with recurrent ulcers. The reality is that most patients who heal an ulcer will face this challenge again. But understanding why recurrence happens is the first step in preventing it. The unfortunate truth is that healing an ulcer doesn't change the underlying factors that caused it in the first place. Think about it this way: if you had a rock in your shoe that caused a blister, simply treating the blister wouldn't solve the problem. Unless you remove the rock, you'll get another blister in the same spot. The same principle applies to diabetic foot ulcers, but the rocks are often more complex and harder to identify. The structure of your foot doesn't change just because an ulcer is healed. If you have a bunion, hammer toe, or other foot deformity that created abnormal pressure points, those pressure points are still there after healing. If you have areas of your foot that bear more weight than they should, those areas remain at high risk for developing new ulcers. The nerve damage that contributed to your original ulcer, the neuropathy that prevented you from feeling excessive pressure or minor injuries, it doesn't improve just because the wound is closed. In fact, neuropathy typically progresses over time, potentially putting you at even higher risk for foot problems. Poor circulation, another major risk factor for diabetic foot ulcers, also doesn't automatically improve after an ulcer heals. If anything, the scar tissue from a healed ulcer might have slightly reduced blood flow compared to normal skin, making that area more vulnerable to future breakdown. Many patients make the mistake of thinking that once their ulcer is healed, they can go back to their old habits. They stop doing daily foot inspections, go back to wearing their old shoes, or become less vigilant about blood sugar control. This is exactly when recurrence is most likely to occur. Another reason recurrence is so common is that patients often don't address the underlying issues that caused the original ulcer. They focus on treating the wound itself, but don't make the lifestyle changes or get the specialized footwear needed to prevent future problems. Missed follow-up appointments are another major factor. Many people stop seeing their podiatrist once their ulcer is healed, missing the opportunity for early detection of new pressure areas or the beginning stages of new ulcers. Now let's talk about the proven strategies that can dramatically reduce your risk of developing another ulcer. These strategies address the root cause of ulcer formation and create a comprehensive prevention plan. Custom diabetic orthotics and specialized footwear are among the most effective prevention tools we have. These aren't just regular shoe inserts. They're custom-made devices designed for specifically your feet and risk factors. Custom orthotics work by redistributing pressure across your foot, reducing stress on high-risk areas where ulcers commonly develop. They can also accommodate foot deformities and provide cushioning for sensitive areas. For many patients, custom orthotics are the difference between staying ulcer-free and developing recurrent problems. The Medicare Diabetic Shoe Program is a valuable benefit that many people don't even know about, or they don't take advantage of it. If you have diabetes and meet certain criteria, Medicare will cover custom orthotics and specialized diabetic shoes once per year. This program exists because preventing ulcers is much less expensive than treating them. To qualify for the Diabetic Shoe Program, you need to have diabetes and at least one of several qualifying conditions, such as previous amputation, history of foot ulcers, calluses, hammer toes, or poor circulation. Your podiatrist can determine if you qualify and help you navigate the process. When choosing diabetic shoes, there are specific features to look for. The shoe should have wide, deep toe boxes to accommodate any foot deformity without creating pressure points. They should have cushioned soles to absorb shock and reduce pressure on the bottom of your feet. The upper should be made of soft, breathable materials that don't create friction or hot spots. Diabetic shoes should have removable insoles so custom orthotics can be inserted if needed. They should provide good support without being too tight, and they should be available in multiple widths to ensure proper fit. It's important to understand that diabetic shoes aren't just about comfort. They're medical devices designed to prevent serious complications. The cost of a good pair of diabetic shoes is minimal compared to the cost of treating a recurrent ulcer. Proper skin and nail care are essential for preventing future ulcers. This starts with daily foot inspections, which should become a lifelong habit, not something you only do when you have an active ulcer. During your daily inspection, you're looking for any changes from the previous day. New areas of redness, callus formation, blisters, cuts, or changes in skin temperature. Pay attention to areas where you have previous ulcers, as these spots remain at high risk. Callus management is particularly important. Calluses form in response to friction and pressure. They also develop in the same areas where ulcers form. While calluses are your body's attempt to protect these areas, they actually can increase pressure on the underlying tissues and hide developing ulcers. Never try to remove calluses yourself using razors, scissors, or over-the-counter callus removers. These can become extremely dangerous for diabetic patients and actually cause the ulcers you're trying to prevent. Instead, have calluses professionally treated by a podiatrist who can safely remove them and address the underlying pressure issues. Proper toenail care is also crucial. Ingrown toenails can lead to infection and ulcers, especially in diabetic patients. Trim your nails straight across and file the edges smooth. Don't cut them too short and never cut in the corners. If you have trouble seeing or reaching your feet, have your nails trimmed professionally. Keep your feet clean and dry, but avoid soaking them, as this can lead to skin breakdown. Use mild soap and warm water. Test the temperature with your elbow to avoid burns. Dry thoroughly, especially between your toes, and apply a good moisturizer to prevent cracking, but avoid putting moisturizer between your toes where it can trap moisture. Routine podiatric checkups are one of the most important prevention strategies, yet they're often overlooked once an ulcer is healed. Regular visits allow for early detection of problems before they become serious. During these visits, your podiatrist can identify areas of increased pressure that might lead to future ulcers. We can spot the early signs of callus formation, skin breakdown, or changes in foot structure. We can also assess your circulation, check for signs of neuropathy progression, and ensure that your footwear and orthotics are still appropriate. For patients who have had previous ulcers, I typically recommend visits every 3 to 4 months, even when there are no active problems. This might seem frequent, but it's much less disruptive than dealing with a recurrent ulcer. These visits also provide an opportunity to reinforce prevention strategies, update your foot care routine as needed, and address any concerns or questions you might have. Lifestyle factors play a huge role in preventing recurrent ulcers. Blood sugar control remains absolutely critical. Remember, every point your A1C rises above normal reduces your healing ability by 10 times. It also increases your risk of developing new ulcers. Work closely with your primary care physician or endocrinologist to maintain the best possible blood sugar control. This means taking medications as prescribed, following your recommended diet, staying active, and monitoring your blood sugar regularly. Smoking cessation is crucial if you smoke. Smoking severely impairs circulation, making ulcer formation more likely and healing more difficult. If you've successfully healed an ulcer while smoking, you've overcome a significant obstacle, but continuing to smoke puts you at very high risk for recurrence. There are many resources available to help you quit smoking, including medication, counseling, and support groups. Your doctor can help develop a quit plan that works for you. Maintaining a healthy weight reduces pressure on your feet and improves your overall diabetes management. Even modest weight loss can make a significant difference in foot pressure and ulcer risk. Regular exercise is beneficial for circulation, blood sugar control, and overall health, but choose activities that are gentle on your feet. Swimming, cycling, and walking with proper footwear are excellent choices. Always inspect your feet before and after exercise. Keeping your feet safe means never going barefoot, even around the house. Always wear appropriate footwear to protect your feet from injury. Be careful around heat sources as neuropathy can prevent you from feeling burns. Check your shoes for foreign objects before putting them on. For some patients, surgical options might be appropriate to reduce the risk of recurrent ulcers. If you have significant foot deformities that create persistent pressure points, surgical correction might be recommended. Procedures like bunion correction, hammer toe straightening, or other foot reconstruction surgeries can eliminate abnormal pressure points and significantly reduce ulcer risk. However, these procedures are typically considered only after conservative measures have been tried and when deformity is severe enough to warrant surgical intervention. The decision to pursue surgical correction requires careful consideration of your overall health, healing ability, and specific risks and benefits in your case. Not all patients are good candidates for foot surgery, and the procedures themselves carry risks that must be weighed against the potential benefits. There are also emerging technologies that can help you monitor your feet and detect problems early. Some practices now use in-shoe pressure sensors that can identify areas of excessive pressure before they cause problems. These sensors can be particularly helpful for patients who have had multiple ulcers or who have severe neuropathy. Thermal imaging technology can detect areas of increased temperature of your feet, which often precedes ulcer formation. Some patients use special socks or insoles to monitor foot temperature and alert them of potential problems. While these technologies are promising, they're not widely available and shouldn't replace regular professional care and daily self-inspection. Remote patient monitoring is becoming more common, where patients use devices at home to track various health parameters and share the information with their healthcare team. This can help identify problems early and adjust treatment plans as needed. Creating a comprehensive prevention plan is essential for staying ulcer-free. This plan should include all the strategies we discussed: proper footwear and orthotics, daily foot inspection, regular podiatric care, blood sugar control, and lifestyle modifications. Your prevention plan should be individualized based on your specific risk factors, medical history, and lifestyle. Work with your podiatrist to develop a plan that's realistic and sustainable for you. The plan should also include clear guidelines for when to seek immediate care. Know the warning signs that indicate a problem is developing, and don't hesitate to contact your podiatrist if you notice anything concerning. It's important to understand that prevention is an ongoing process, not a one-time effort. Your risk factors may change over time, and your prevention strategies may be needed to be adjusted accordingly. Regular reassessment and plan updates are essential. The good news is that with proper prevention strategies, most people can avoid recurrent ulcers. Yes, the statistics show that recurrence is common, but those statistics include many people who don't follow comprehensive prevention plans. Patients who consistently follow prevention strategies, wearing appropriate footwear, doing daily inspections, maintaining good blood sugar control, and getting regular professional care have much lower recurrence rates. Remember, preventing a recurrent ulcer is not about avoiding the inconvenience and discomfort of another wound. It's about preventing the serious complications that can result from recurrent ulcers, including infection, hospitalization, and amputation. Each time you develop an ulcer, your risk of serious complications increase. The foot becomes more vulnerable, and the healing process might become more difficult. That's why prevention becomes more important, not less important, after you've healed your first ulcer. I want to emphasize that staying ulcer-free is absolutely achievable with the right approach and commitment. Many of my patients who have healed ulcers go on to remain ulcer-free for years by following comprehensive prevention strategies. The key is making prevention a priority and understanding that the effort you put into prevention is much less than the effort required to heal another ulcer. What's your biggest challenge in staying ulcer-free? I'd love to hear from you in the comments. Your experiences and questions can help other viewers develop better prevention strategies. Thanks so much for watching today's video. If you found this information helpful, please share this video on social media. Your simple share can help a friend or family member get the early treatment they need. Don't forget to order your free copy of my comprehensive book about diabetic foot ulcers at www.footulcerbook.com. This book contains detailed prevention checklists and strategies that can help you stay ulcer-free. If you'd like to develop a personalized prevention plan or you're due for a routine foot checkup, don't wait. Contact our office to schedule an appointment. The link is in the description below. Remember, an ounce of prevention is worth a pound of cure, and when it comes to diabetic foot ulcers, prevention is always easier, less expensive, and less risky than treatment. Thanks so much for watching, and have a great day.